Take you to this story now. The brain drain has left South Africa with a shortage of medical specialists. According to Health Department data, there's a vacancy rate of about 18.6% for medical specialists. And this is putting a strain on the already overburdened health sector. Dr. Angelique Coetzee, Solidarity Doctors Network board member, joins us now to discuss this. Thank you very much for your time this morning, Dr. Angelique Coetzee. Maybe just paint a broad picture for us on how bad the situation is when it comes to medical specialists choosing to practice in South Africa.
Good morning. Yeah, it is indeed a very bad situation. I think just for background, we need to understand that we are losing our high net worth individuals overseas, and roughly about 1,900 millionaires left since the last recorded figure in 2020. The second thing is most of the doctors falls into the higher personal tax income bracket. So we simply cannot be taxed anymore to sustain the high unemployment rate, let alone the NHI. Now it comes back, are doctors against NHI or universal health coverage concept? So NHI is the funding model. Doctors are not against the universal health coverage concept. It's the NHI, which is a huge problem for us. And if you look at these HR figures, we know that there was not even enough monies to retain the temporary staff that was employed for COVID. How are we going to employ these doctors and nursing staff that there are dire need of? We know that in the Northern Cape, 46% of specialist medical personnel, there's a vacancy rate. We know that Free State's got the highest rate of 25% of all vacancy posts. So how are we going to fix this problem? And remember, the huge concern about NHI under the doctors is the oversight, the accountability, the lack of proper governance that we see. But the most important thing is the trust and the confidence in the current government. There is no trust currently in the government's ability to make this work. So we can't even fix this vacancy rates, which lead to underservicing of our members and patients across the country. It leads to fatigue. It leads to poor outcomes of those patients. And on top of it all, we need to understand the training of the nurses, the quality of nurses and the training systems currently used. We need to understand that NHI, as what we are seeing now, would mostly be nurse-driven, according to a lot of the data that we have seen, especially from National Department of Health. So it is a problem going forward.
No, it absolutely is. And I mean, you've painted a very dire picture, Dr. Coetzee, in that the fact that we've got so few resources in the form of medical specialists and advents like the pandemic as an example, surely this should be at the top of the priority list for government and related stakeholders to handle before it gets to a point of no return, basically.
Well, I think we've already reached, or we're very, very well on our way to reach a point of no return. If you look at the specialist training, there's only a handful of specialists per subspecialty that's been trained as registrars, or these registers post. And then on top of it, most of these hospitals, especially the public sector, are making use of the community service doctors and the interns to sustain their infrastructure. It cannot be. You need people with skills, and this is a huge problem. Whether it's skills in specialist skills with experience, you cannot expect someone that's not experienced to be able to run a clinic or to be able to give good opinions. Unfortunately, that comes with time. And if we keep on with these type of restrictions of employing or opening up of posts for specialists, it's going to bite us. It's already biting us. And the NHI, it's going to be even worse, because NHI means, will there be enough money to employ these doctors or to get them posts to specialize? So far, we don't have a good track record of that.
No, absolutely. And of course, another important element of this particular conversation, Dr. Coetzee, is the strides being made to creating public-private partnerships to perhaps alleviate some of the burden that our specialists currently face.
There is not really a public-private specialist partnership going on that I'm really aware of, a good one. And it's not that the private sector doesn't want to be part. It is the paranoia of the public sector. There's a lot of private sector institutions, especially I know about Solidarity, I know about the Foundation of Professional Development, who are willing and have asked, let us to help training the nurses, let us help training doctors, medical doctors. And so far, there's just a bland refusal from the higher education and CITA. So this needs to be addressed, even if we need to go to court. But this needs to be addressed within this next 12 months, because we cannot carry on as it is. And there is no current partnership that is really a partnership showing value or outcomes.
Thank you very much, Dr. Angelique Coetzee, there, painting a very bleak picture about the brain drain on medical specialists and the implications this could have on the country's health system as a whole. Thank you very much for your time this morning. And